Okay, so today we're going to be talking about head to toe assessment. To start, I'm going to wash my hands, do any pre-procedure laws such as proper PPE, safety check, providing privacy, and of course, like I said, washing hands. So once you finish that, you're going to go ahead and start with identifying yourself and the patient. So once you identify yourself, you're going to check the patient's armband, make sure that this is the correct patient you're seeing. And once you get that completed, you're gonna go ahead and start by getting the vitals. So while you're getting the vitals, you can also assess the alert and orientedness by asking the patient's name, the birth date, what current year it is, the next holiday, and even the last meal the patient had. So once you have that all ready and recorded, you're gonna go ahead and start from the head to the toe. So starting from the head, you're gonna wanna check for any asymmetry, any abnormalities, as well as any assistive devices, such as the hearing aids, the glasses, the dentures, and the supplemental oxygen. So once you check that, you're gonna go ahead and start with PERLA, which is the pupils equal and reactive to light and accommodation. So once you check that, you could also check for the divergence or the visual acuity of the patient to see if their eyes will move towards their midline, the midline of their face. Then once you have that done, you could go ahead and check the conjunctiva, the lip for any discoloration or any signs of dehydration, as well as the mucosa on the nose if it's dry, and any extra cerumen in the ear, if there's any of that. And then we're gonna go ahead and start going down. So I would check for the carotid pulse, check the quality of the pulse, of course, get like a baseline of that, and then you're gonna go ahead and start going down. So I could check the skin turgor over here for any tenting, signs of dehydration, and then while we're at the neck, any signs of JVD, as well as the tracheal alignment, see if it's straight, and any lumps or anything, any swollen lymph nodes you could note too. And then once we go down, I could start with the lung sounds. So within every auscultation point, you're going to want to have them breathe in and out as best as they can, not going too fast, of course. And then once you have that, you're going to document any abnormalities such as crackles, wheezes, absence of breath sounds, and any abnormal findings you see. And then once you have that done, you could go ahead and start with the heart sounds as well. So you're going to want to follow the ape to man, all points, and then you could even grab the apical pulse at this time, listening for a full minute and recording that. And then once you get that done, to get it out of the way, you could already start with the bowel sounds as well. So you're going to want to listen to all 4 quadrants and listen for any hyperactive, normoactive, and any different sounds you hear. As we know, since we are in GI, you could check for high-pitched sounds to indicate diverticulosis, etc. And once you have that done, you will go ahead and start with I like to start with at least the upper extremities. So I would have I would check the grip strength, the bilateral pulses if there's a pulse deficit, as well as the mobility of the patient. So any range of motion, if they could move their arms bilaterally, the same strength, as well as have the same ability to any locomotion. And then once you're done with that, you could even check for the capillary refill of the patient to see if it is good or bad or more than 3 seconds. And then once you have that done, you could go ahead and just ask any other questions that the patient may have or concerns, such as like any pain, any reported pain when upon doing something with your upper extremities. If not, I would go ahead and inspect the stomach area or the lower part of the abdomen. So looking for any signs of distension, palpating to see if there's any hard areas anywhere, any discomfort upon palpation for the person's bladder. And then once you have that done, I would go on to the genital urinary GI system. So asking their last bowel movement, of course, checking if their urine is any different colors, any difficulty urinating or passing the bowel movements. And then I'd also ask if they're male or if they're female. If they're female, I would ask their last menstrual period if they were to have one, as well as for the males, any history of prostate cancer. So once you have that, ask any questions and answer any questions that the patients have to have a baseline of what they are more cautious about. And then moving on, I would go to the thighs and the lower extremities. This is where I'd be able to check for any edema, because edema does occur in the lower parts of the body. So I would press for any place that looks like they have edema. I could also check the popliteal pulses, the dorsalis pedis, and as well as the range of motion for the patient. So if they are on bed rest, if they have dropped foot, I would also record that. Any weaknesses that are only subjected to one extremity rather than to the other. So any unilateral abnormalities I would look for. And then I would also check for the range of motion, so the dorsiflexion, plantar flexion, the flexion and extension of the patient. And then to end it off, I would ask any psychosocial questions. So how are they today? A little bit about themselves, why they're here, etc. Just to check the psyche of the patient to make sure that they are well. And then for closing remarks, I would go ahead and thank them, of course, and then I would go do that last safety check and make sure everything is okay. And then after, I would perform hand hygiene, doff any PPE to go ahead and chart what you found for the head to toe assessment. That should be it. Okay. Bye.